Welcome to Inside Marywood Health Sciences, where it's all about real voices, real stories, real Marywood. I'm your host, Samantha Miko, and today we're exploring a department where communication, connection, and compassion all come together. Communication, Sciences, and Disorders. Joining me is Andrea Novak and Renee Jourdanais. Thank you so much for being here. Let's start with something simple. What are each of your titles, and what do you do for the department?
Well, I'm Andrea, and my title is multifaceted. I am currently the department chairperson, but I am also the graduate program director. I am faculty and a supervisor, and also the advisor to our student organization.
And I'm Renee, and my official title in the department is clinic director, but I'm also a professor of practice. I teach some classes within the major, and I also clinically supervise.
Great. So for those of you who don't know, can you explain a little bit about communication sciences and disorders, or speech language pathology, and what it actually is?
Communication sciences and disorders would be an umbrella heading. Under communication sciences and disorders would be speech language pathology and audiology. So here at Marywood, we have the speech language pathology program, and speech language pathologists work with individuals on their communication skills. That would include their speech, their language, their thinking, their swallowing, their social skills, anything that deals with communicating with one another.
So, a lot of people have a story of when they're younger, or, something that's happened to them. What drew you to the speech language pathology?
It's funny. I was supposed to be an art major. So late in high school, that's what I was applying to schools for. And then I had a friend that was born with a malformation in his brain, AVMs, and had a couple of strokes as a young man. And so that kind of turned me to look towards this profession just a little bit more as he was going through speech therapy.
When I was in high school, we had to do service projects in the community. And the one group of students and myself did a service project with what was then the Scranton State School for the Deaf. And so I really enjoyed going to the school, interacting with the students that were there, learning sign language with the students. And I heard about Marywood's program, and I thought it was a lot of information based in that area of working with individuals who were hard of hearing or deaf. And when I came to Marywood, I found out that speech language pathology was actually much more than that.
That's awesome. So when you came to Marywood, what did you see that was unique about our CSD program compared to others?
For me, it wasn't actually about the program. It was actually about Marywood itself. So I had visited other schools, and they were just, in the basement of a big hall, and they really didn't have like the type of atmosphere that I was looking for. And I grew up in a very rural part of New York State, so I was going out of state for school, because I actually am a Marywood grad at the undergraduate level, as was Andrea. So for me, it was about Marywood College at the time, but it was about it just the actual like atmosphere of the campus, and then the surrounding areas was something that kind of was a nicer fit for me personally. So it was a little bit more about the university versus the actual department for me.
From my standpoint, I am a local gal, so Marywood was in the community. It was something that
Andrea is also a grad of the undergraduate program here.
I am, yes.
Little known fact, that all of our clinical supervisors within our department are Marywood grads.
And that speaks more to anything. You guys came back and wanted to teach.
Yes, definitely. So being local, Marywood was just on my radar of being here and being familiar with the campus. And way back when we both graduated, I wouldn't say that there were a lot of other programs at that time that were in closer proximity. I have a lot of family in this area. I wanted to stay closer to them for my undergrad program. And so Marywood was just a good choice for me, and it had a program that I was interested in.
This break is brought to you by Lauren Tokash from Graduate Admissions, reminding you to come to Graduate Open House on April 29th at 5:30 p.m. See you there.
Okay, so you guys have a clinic on campus. So what courses do you think help with this clinic, and what do students get to do in this clinic experience?
Ooh, well, I think with the courses we provide in the department, all of them lead up to clinics. So right now we have a 5-year degree. So they're really building that base of knowledge for their first 3.5 years. So like all of the courses give them that underlying sort of, basic knowledge, scientific knowledge. Then they take a course in their junior year, clinic methods, that prepares them for clinic. So they start their first clinical experience in the summer after their 3rd year. So, and that's the undergraduate clinic. And then from there, we move into a rotation through the next 2 years, each semester having a clinical experience. Sometimes that's working in the clinic. Sometimes it's doing evaluations within the clinic. We also have a practicum in our audiology clinic that's also within our department. And then their last 2 experiences are off campus at an adult placement and a child placement. So as far as the coursework, I think all of the coursework sort of works, in preparation to each clinical experience that they have. Would you agree?
I would agree. And Renee mentioned the 5-year undergrad program into grad, but there's also a standalone 2-year grad program. So, the coursework that they do at the undergrad level is more your foundational coursework, like you mentioned, and then we build upon it on the grad level. So they're continuing to build that knowledge base and skills. And any students coming in from outside programs for the grad piece, they'll get those skills as well in the graduate courses to help build the clinical piece and working in the clinic with our clients.
Mm-hmm.
So for someone who's never been down to the clinic, what could you expect if you take, is it children go to this clinic, adults? What could your child, adult, what could they expect going to this clinic?
I'm gonna say we're the what do they call us? The best best kept secret in northeastern Pennsylvania. How many clients do we have?
Right now we have over 90 individual clients, plus all of our groups that are on campus and off campus. But right now we currently service children ages 3 years of age and up. Sometimes a little bit earlier, but 3 years is really when we start getting them in the clinic. Otherwise, they're receiving home services. Typically, but our oldest client right now is in their 90s. So we, one of the things with our program is you have to show clinical experience across disorder and across the lifespan. So at our clinic, that's what we do. So we have the young preschooler, we have the school age child, we have the young adult, the geriatric client with a variety of different disorders and deficits. Yeah.
So might be your typical child who's a little bit slower developing their speech or language skills, or children who are on the autism spectrum, genetic syndromes, clients who may have had brain injury from a stroke or head injury, something like that. Some of your progressive neuromuscular disorders. So a wide variety of experiences our students work with. And those are just individual clients. Renee mentioned we have groups as well.
Mm-hmm.
So what do you think your students are most nervous about when they start clinical?
Oh, I think it's fear of the unknown. I mean, they have enough time to be able to observe in the clinic. They certainly have enough coursework behind them, but I think it's just that, like you get butterflies each time you go in, which I always say, it's a good thing, being an athlete. I always said, like, the first time doing anything, the first time, it just shows that you want to do something well. And so I think nerves are a really great part of just showing that, you want to do your best and you're doing best for others. I think, just that those first interactions, whether it be with the client, with their family member, the first time they have to talk with a physician, the first time they have to talk with, an outside professional, I think there's a variety of firsts that cause nervousness would you agree?
I would agree, but I would also say that after they've completed that first session, they're all smiles. They think it was like the best session in the world, and they get so excited and they love their client. And some students come through and say, I only ever want to work with children. And then by the time they graduate, they're in love working with adults, and vice versa. Those who only want to work with adults, and then they have their first child that they're working with, and they're like, oh my gosh, this is so great. And they really enjoy the experience. And as clinic director, Renee does a really nice job. And part of her position is that she has to provide that experience across the lifespan to all of our students. So she keeps track of, who's working with a child, who has an adult, who has this type of client or that type of client, just to give the students the diversity that they need in terms of ages and disorders, things like that.
So to piggyback off of that, do you see that kids are more afraid of working with children or adults? Do you think there's something that they request certain?
It's different. There are some students of ours that come through and they're familiar with children because they have siblings or cousins, or they've worked at a daycare or something like that. Counselor, yes. And so they're maybe comfortable working with children, and so they're like, oh, working with an adult. But then there's just the opposite, where students have not had someone in their family or in the community that they've interacted with from the child side, so they feel more comfortable working with someone who's closer to their age. So it varies really depending on whichever student you're speaking with. It's nice to see that the differences among students.
Looking to make a difference and deepen your impact in the field of social work? Join us at the Marywood University School of Social Work Symposium on Tuesday, April 7th from 8:30 a.m. to 12:30 p.m. at the Nazareth Student Center, Upper Main. This year's theme, From Crisis to Connection, Solidarity, Social Justice, and Collective Action in Social Work, brings together professionals and students for a powerful morning of learning and connection. Hear from keynote speakers Jenny Gonzalez, community activist and director of the STARS program, and Ushu Nikelo, president and CEO of the Congolese community of Scranton. Continuing education credits are available, and lunch is on us. Don't miss this opportunity to grow, connect, and be inspired.
So a big part of the health sciences is the collaboration of multiple departments coming together. How would you say that your department collaborates with all the departments across the health sciences?
Well, I would say that whenever the opportunity arises, we always try to have our students collaborate with other students from other departments. So others may have mentioned this already in previous podcasts, but in health sciences, we oftentimes, when we can, have a healthcare discovery day. So communication sciences and disorders, nursing, physician assistants, so on and so on. We present to high school students about the different professions and how we work together. And we typically have a case study that all the students are working towards gaining knowledge on. There's something that happens similarly with the departments here on campus, where there is a
interprofessional symposium.
Yeah, like an interprofessional symposium where the different departments get together, they learn about each other, they work on a case study together and see how, when they're in the professional world, how they would relate with one another and what each department, their own expertise areas are. From my standpoint, specifically in our department, I present to our students about interprofessionalism, interprofessional practice, and the different types of ways that when working in a hospital versus a school versus a skilled nursing facility or something like that, how you would be working with other professionals who might be on your team and how you have to respect other people's discipline and be aware of what they each do.
I was going to say, similarly, as part of our graduate clinic protocol, we have mandatory in-services and we do interprofessional practice in services. So we've had individuals from psychology and counseling, we've had individuals from social work, education, nursing come in and talk with the students about what their profession is. It's not necessarily student to student interaction, but at least other departments within campus. And outside of campus, with that being said, but we, teach them about what that profession does and then how we would collaborate once you are outside of Marywood and, pursuing your profession.
Well, and beyond just inside Marywood, how do you guys collaborate with the community?
So on the clinical side of things, I think, we do things departmentally as well. We do outreach to certainly to high schools in the area. There's the job fairs and things along those lines to try to career days at the high schools to kind of spread the word about our department. But then as part of the curriculum, we We also allow for our students to go into the community. We do outreach into local preschools in the community, as well as to do hearing screenings, speech and language screenings. And then we also have a variety of groups. We service, I know Andrea services one of the daycares here on campus. We have outreach to St. Joseph Center. We have outreaches to local preschools, Marywood Heights, Trinity Center, the OLP Center. So we do a lot of things outside of our department that are on or within the constraints of the Marywood campus, but then certainly reach into the community a little bit wider for either screening opportunities or just group opportunities. Particularly one of our newest ones is outreaching into classrooms in the community, specifically for children diagnosed with autism, ABA centers in the area. And then with that being said too, the NEIU, we have two, right now currently we have two classrooms on campus, which I'm sure most people are aware of. It's housed in the McGowan Center where a lot of our departments are, the SOAR and the STRIVE groups that are a part of our campus community, and that's through the local NEIU and school districts. So we kind of have our hands in a lot of things, either on campus and then of course outside of campus as well.
We're all over the place.
You have a full plate. You really do.
We do.
We do.
You really. Is there anything that the students seem to gravitate towards more when it comes to community-based?
In my opinion, I don't think there's one area that everyone gravitates to. Everyone has different interests. You know, some students like to work with the young children, some students like to work with older populations. So I think, and the way that the clinical experience is set up, everyone will rotate through. So for any particular semester, you have your clinical assignments, whether it be individual clients or group experiences, but the next semester you'll rotate to something different. So it gives our students the opportunity to experience everything that's out there, as opposed to just one group or one type of client.
Yeah, and I think each semester, it's already happened this semester with their new clinical assignments. You're like, oh, I'm so happy I got this group, or oh, I'm so excited to be going here. You know, I've wanted to do that. So I think it you know, every opportunity brings some, you know, new learning and new experiences. And, you know, I think it helps them to discover a little bit what they like more and more each time.
Exactly.
Yeah.
So what advice would you give a student considering the communication science department?
I would definitely tell a student who is interested in our program, like, give it a chance. Like, I think a lot of students think that our program is very challenging.
It is challenging.
And it is, but it's a very doable program.
Yeah.
I think I would tell students, you know, get involved. Part of the profession is interacting with people. You have to interact with your faculty members. You have to interact with your classmates. You have to interact with the clients that come in for services and their family members. So go out there, like, put yourself out there, interact with people, take a chance, get involved. Definitely pay attention to the details. The details are so important, and a lot of people just breeze over the details, but you lose a lot of important information in that piece that a lot of people don't always pay attention to. So I think I would tell them, put yourself out there, take a chance, pay attention, and something that seems very challenging, you're going to find is definitely doable.
More rewarding in the end.
Yes, it's rewarding.
So on top of that, we now know why to choose the department. Why should we choose Marywood?
I think Marywood is fabulous for a lot of reasons. I think specifically for our program, what our students comment the most on, which I agree wholeheartedly, is that, you know, we're a smaller campus, we're a smaller department, and, you know, it is hard. Our program is challenging. But I think the level of support that you can get here to be successful in whatever way that might be, it's completely doable here. You know, the atmosphere, whether it's your other cohort members, your classmates, your professors, your clinical supervisors, like, everybody is here for the same purpose, and that's to get a degree, succeed, and be a professional that is going to leave Marywood and serve it well, you know.
And I think to add on to that, another reason for people to choose our program is the clinical experience. We've spent the afternoon talking to you about the individual clients, the group sessions, how we outreach into the community. And, we have an on-campus speech language and audiology clinic. We didn't even really talk about the audiology clinic, but as a student in the program, you get so much hands-on experience, whether you're in the undergrad piece, being able to observe all of the clients, or in the transition to graduate piece and being able to work with all of the clients. Like, you have live clients coming in that you're working with, that you're observing, that you're talking to, which is such a different experience than to be working with a client virtually or through some sort of alternative means, rather than having someone face to face.
That's great. You guys definitely sold me for sure.
Come on down.
But before we go, we're going to play a little speed round, okay? So, would you rather text or call someone on the phone?
Text.
Ooh, I don't know. I like either or. I'm
Big decisions, you have to talk. So I'll do
right.
that.
Big
But otherwise, snarky texts, yes, that's what I like.
Yes, definitely.
Means
I would agree
whatever.
with you.
Yeah.
I would agree.
Clinical or research?
Clinical.
Adult or pediatric population?
Adult.
Adult, but I will say I do enjoy working with the pediatric population as well.
Rehab facility or early intervention?
Rehab.
Most chaotic week of the semester?
Clinic closeouts.
Oh, I guess it could be starting clinic.
For me, it's closeouts.
So beginning to end.
Yeah.
No, the in-between's really nice.
Yeah, it is really nice once you're good to go and ready to go.
Yeah, I think
and-
it's just, timelines and things like that. Yeah.
How about AI in your department? Exciting or scary?
Maybe a little both, but more exciting.
I'm hesitant on AI. I feel like students need to know how to do things, and if they just resort to AI, you don't always learn how to do things. AI is a good backup.
Yes.
For me, AI is a good, let me check something, but I feel like you need to learn it to do it.
So how about swallow studies? Underappreciated or properly respected?
Underappreciated.
They need to be properly respected. They are so important. But you're right, a lot of people underappreciate them.
And one last one. What is one resource every student should use in your department?
My personal opinion is that they should have a calendar to be able to mark things down, mark down their meetings, mark down their clinical appointments, mark down due dates. I think a calendar is important. But more importantly, who's the best resource in our department?
Our admin.
Our admin,
Our
Bree.
department coordinator.
That's
It's
right.
Bree.
Yes. Bree. She's the wonderful department assistant coordinator
Backbone.
who knows all and can do all, and she's your best resource.
Well, shout out to Bree. I'm sure she'll be really excited when she hears this. Well, thank you so much to both of you for joining us and sharing your passion for teaching and your dedication to our students. And thank you to our listeners for tuning in to another episode of Inside Marywood Health Sciences. Real voices, real stories, real Marywood. Be sure to subscribe so you don't miss future episodes. And if you enjoyed today's conversation, share it with a friend or a future pacer. To learn more about the College of Health Sciences, visit marywood.edu/health sciences or follow us on Instagram at MarywoodCHS. Until next time, I'm Samantha Miko, and this has been Inside Marywood Health Sciences.